You also perform the gastric sleeve surgery and gastric application surgery. What does the gastric sleeve surgery involve?
So the sleeve gastrectomy is a surgery by which the storage capacity of the stomach is diminished on a considerable way. This is done by a resection of the fundus and the corpse, the body of the stomach, alongside a tube which we call a 34 French tube. This is about the thickness of a finger, that tube, and alongside that tube all the rest of the stomach is resected by using endoscopic stapler resection devices. That way people can only eat after that surgery a few spoons. They have to wait till that amount of food is gone through the pylorus. The same way happens when we do an imbrication sleeve, but then we don't resect the stomach, we just suture 3 to 4 layers on the stomach outer side so that the inner side of the stomach becomes a small tube again. The advantage of this type of surgery is the fast procedure, low risk, and it's a procedure that is almost possible on every patient. By doing the sleeve gastrectomy, people, besides the restriction, also have a feeling of less appetite by reducing the amount of active ghrelin. So that's an advantage that we see after the sleeve gastrectomy. The ideal candidates for sleeve gastrectomy are, it's also personal choice of course by the patient, but I think people who really eat a lot, who have high volume intake of food, those people I think have a good success with weight loss. People who are grazing and eating little things all day through, those people haven't that much success with a sleeve gastrectomy.
Are there certain disadvantages or typical risk related to the sleeve gastrectomy?
Yes, people lose their stomach when it is a sleeve gastrectomy for 2/3. So we can't reverse that type of surgery. That's one problem or one disadvantage. Another disadvantage is that people, some complain of a little bit more gastroesophageal reflux, more acid reflux. That is typical for sleeve gastrectomy. And sometimes some stomach ache, which is not dangerous but can happen.